All right, Mr. M here, you guys, Mr. Medellin, and today we're going to be going over the elbow. So what we're going to be doing is the AP elbow. We'll do the AP elbow medial oblique rotation. That's going to go ahead and be inward. And then we'll do the AP lateral oblique. So that's going to be the outer rotation, lateral rotation. And then we'll do the lateral elbow. And you know what else I'll also do? I'll do the partial flexion extension. Okay, let's go ahead and get this started. So what I'm going to do is I'm going to turn the disruptor lengthwise here with the long axis of the part. We're going to have you extend your elbow over this way here. It's going to bring you forward, just like that. I'm going to bring this over. We're going to go ahead and get it centered. I'm going to move this over here. Okay, we're going to go ahead. All right, and I can see my patients already lining themselves up. That's nice when the patients can do that for you. So we got this set up here. The epicondyles are parallel to the receptor. I put my marker here. I got about maybe, I can come down just a little bit. There you go. I got about maybe 4.5 inches here below the elbow joint and about 4 inches above the elbow joint. Again, here is your lateral epicondyle. The medial epicondyle is going to be more prominent. You want those condyles and epicondyles to be parallel to the image receptor. On the AP elbow, the joint space between the radius and the ulna is not going to be open. It's going to be closed, but that's okay. That's what we want. And this is your AP elbow. All right. So I'm going to go ahead and transition now into my medial oblique. All I'm doing now is just turning the hand over. I'm going to pronate the hand. All right. You can relax there. There you go. And let me show you what's happening here. So now that I turned the hand over and I just pronated it, his epicondyles now are going to be oblique at about 45-degree angle here. I don't know if you guys can see that. So just by pronating the hand, it's going to place my epicondyles 45 degrees. So when you do a medial oblique rotation, you're going to see the olecranon process or the olecranon in the fossa, and you're going to see the coronoid process in profile. So I'll show you with the skeleton in just a little bit. After I do all the projections, I'll show you what we're going to be seeing. So this is an AP medial oblique with medial rotation. All right, so this is going to be, again, it's still AP, but it's rotated inward, so that's going to be medial rotation. So the next one here, I'm going to go ahead, turn the patient's arm back over. I'm going to pick up his arm, and I'm going to drop it down here, and then I'm going to roll it this way. Okay, right there. Not too much, relax. All right, can you scoot back a little bit? Right there, there you go. Just drop your thumb down. There you go, just like that. You want to drop that thumb down. So the thumb is down, all the way touching the IR, and now we're rotated 45 degrees the other way. So in this rotation, it's lateral rotation. So you're rotating externally outward, and you're gonna see the radial head separate from the ulna. So if they ask you a question, which projection or method or position will best demonstrate the radial head free superposition from the ulna, it's going to be an AP elbow with lateral rotation. They're going to go ahead and come away from each other. All right, so now we're going to be doing another one here, and this is going to be the lateral elbow. So we're going to go ahead and turn your arm this way here. So notice I'm not doing much in terms of changing the collimation and all that stuff here. All right, everything's almost the same here, right? So I'm going to bring this arm here, just like that. I got this long axis here. And again, of course, you guys, if there's trauma, you know, we're going to have to find ways to get creative and get these positions. In fact, we'll do a trauma, an episode or a video for trauma. We'll do the coil method, and I'll show you a cross-table lateral for the elbow as well. I used to do trauma. I used to do orthopedics. I worked in acute settings. So again, we'll show you how to do that. But right now, we're just going to focus on, you know, your ambulatory type patients. So now we got the elbow flexed 90 degrees. We got the arm flush to the IR. The arm is flush to the IR. The elbow is lateral, and so is the wrist. I have the thumb cocked back too a little bit here. And what you want, you guys, is about maybe 4 or 5 inches from each side of the joint here. And this is going to be the lateral elbow. So this one, you're going to see the olecranon process in profile. You're going to see the trochlear notch and the trochlear sulcus. They're going to be shown like this here. You're going to demonstrate that. The radius will be, the radial head will be superimposed over the ulna, and that's what you want to see. So again, each of these projections that we're doing, you're going to change what you're seeing. So really take a look at the structure shown section in your textbooks, whether you're using Merrill's or Bontrager, it doesn't matter, but make sure you go over that anatomy. All right, so now I'm going to show you guys one of the trauma views. So if somebody had trauma, what we're going to have you do, let's give you some trauma, right? We're not going to hurt him, of course, but let's say he has an injury to his elbow and he can't fully extend. Well, it's called a partial flexion extension. So we're gonna take 2 projections, 2. So just like you did before, we're gonna go ahead and do one here just like this with the arm flush. All right, so I'm gonna close that up just a little bit here. I'm gonna go ahead and put my marker here. So this is a partial flexion, right? An extension of the elbow. You're gonna do 2 APs is what you're doing. One with the arm flush and the next one, so you make an exposure, boom. All right, and I usually use about 2.5 to 3 mass at about 60 kV for this elbow. The next one, what we're gonna do is we're actually gonna have them stand up a little bit or kind of scoot up. There we go, and you're just gonna go forward. So keep your arm like bent, like if you're, in trauma, just like that. There you go. So now we're doing 2. One with the forearm flush, parallel, and the other one we just did was the arm that was parallel. So the doctor will put those 2 together and they'll use that to help with their diagnosis. All right, but I just wanted to show you guys this. This is still relevant to the field. It's relevant to, what we do as techs, and it's still relevant to the ART outline as well. It's on the content specification, all right? But this is gonna be your elbow projections, okay? I'm hoping that this will help you.
Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.